To do what I think is going to be a really exciting talk. This is a novel approach that you all are taking, novel method that you're using in terms of your work with visual material. So I'm really excited that you're here, and let me just take a few minutes to introduce both of you. So thanks for being here, Jane. Sorry about the confusion this morning. Jane G is an MD, MPH, and also has a master's in science and is a practicing general internist, investigator, and associate professor of medicine in the Division of General Internal Medicine at UCSF, which is where many of us are located. Her funded research program aims to reduce health disparities and promote health equity among multiethnic and linguistically diverse adults by developing and evaluating innovative patient-centered interventions. Dr. G's current stakeholder-engaged and clinical practice-based research focuses on the impact of social determinants of health, including race, ethnicity, language, and culture on chronic disease care, particularly among those with multiple chronic conditions. B, patient-clinician communication about social determinants of health and unmet health-related social needs, such as food insecurity and transportation barriers. And C, use of photos as a tool to communicate about health and social factors important in chronic disease care. This work is based on the premise that photos can promote efficient information exchange and activate patients to communicate their complex lived experiences, including their goals and preferences that may otherwise be difficult to elicit or challenging to discuss in current clinical practice. Thanks for being here. And Jane is joined by her colleague, Antony Nguyen, who is a master's in public health, a recent graduate with concentration in epidemiology from Columbia University Mailman School of Public Health, and a longtime research assistant to Professor Jane G at the University of California, San Francisco. His motivations in research were inspired by prior experiences working with Professor G and as an AmeriCorps member in local health jurisdictions and nonprofit organizations. Antony's research interests include applying intersectionality to qualitative methods, early childhood adversity, non-communicable diseases and injuries, and social needs care and primary care and safety net settings. And Antony and Jane are here today to talk to us about their work doing a two-step coding process of visual data. So thanks again, and I'll let you take it away.
Thank you, Kim and Julia, for having us today. Sorry about the technical snafu. So let me go ahead and share my screen. Okay. So Anna and I are today going to talk about the use of photographs to understand the context of health. It's recently a public paper that we've published, kind of informed by some of the work that our group has been doing over the last few years. And so we're going to share in the presentation. I'm going to start out, hand off to Anthony, and then I'll do one part, and Anthony will do the other part in terms of the actual use of Dedoose to help code and how we developed it. We have no disclosures to share. So I wanted to acknowledge there are many people to acknowledge in the work that we've done, including the current research lab. But most, we want to acknowledge the research participants in which we utilized photographs they had taken to help develop this methodology, as well as our co-authors, and Luisa Antonio, who is the executive director of the Biennial Equity Center, who we collaborated to initially collect this data many years ago. And this is our funders for this work. I'm going to pass it to Anthony to share a little bit about ourselves, because I think what we bring to this work and sort of our placement and how we see the world are important aspects to consider.
So hi everyone, I'm Antony. Here's a little bit about myself. I was born into a Vietnamese refugee family. They sought asylum after the war. I'm initially from Savannah, Georgia, which is known for a lot of things, but I'm just going to point out that it was the backdrop for the movie Forrest Gump. Also coming from Savannah, I grew up with my own personal experiences as being Asian American and part of an ethnic minority. And a lot of those experiences are really tied to attending an all-boys Catholic military school. Currently, I'm an interpersonal violence prevention fellow with the CDC Injury Center, actually. But I'm also Professor G's research associate. I've been working with Professor G for 6 years now. So starting out as a research intern when I was an undergraduate, and so it's kind of great to actually be able to give talks alongside her now. I recently graduated from Columbia University, as mentioned, with an MPH in epidemiology, and before that, I did my undergraduate degree at UC Berkeley. And in between my degrees, I served in AmeriCorps, serving at an elementary school in Oakland, and then within the San Francisco Department of Public Health, doing projects on COVID vaccine outreach and cancer screening for underinsured patients in the San Francisco Health Network. In addition, I was doing a lot of work with youth from underserved areas, and especially justice involved teens. So those experiences were really what inspired my motivation in research and injury and violence prevention, multimorbidity, and a lot of the social underpinnings of the determinants of health. But just for some fun tidbits about myself, I'm currently based in New York City, and I would totally argue that the best pizza is found at Prince Street Pizza in Soho. Mama Two's in the Upper West Side and Paula G's in Brooklyn deserve honorable mentions, of course. On my weekends, I am out with friends hunting down cozy speakeasies, but given how frigid and how cold it is outside right now, dinner parties are currently kind of the thing to do. I kind of make my friends trek to me in the snow so that I can test my cooking on them. But outside of this, the only other hobby that I claim for myself is graphic design. And at the end of the day, I look forward to furthering my career in medicine and public health and academia. I'm glad to be here today. Thank you.
Thank you, Anthony. Okay, so a little bit about myself. So I'm also a child of immigrants. My parents were born and raised in Taiwan and immigrated in the late 1970s. So I'm a birthright citizen. My dad came here as a graduate student, and we grew up in the Chicagoland area, which I think informs a lot of my experiences as an Asian American woman. And I think the foundational experiences that led to the work that I do now were really when I was a medical student at University of Illinois, and I did a Albert Schweitzer project to work in underserved communities, and I focused in the Filipino community. And out of that work, we started a nonprofit called the Filipino American Health Community Initiative of Chicago. And I think this is part of my roots as a community organizer, engaging the community. And the reason we had worked together and started this organization was we had known there were cardiovascular health disparities in the Filipino community, and yet, there was no data to describe it, to understand it, to anything to do with it. And so the work that I do now in part is born from those experiences. And, why is a doctor talking about a qualitative method? If you had asked me 15, 20 years ago, if I thought I would be doing this would have been a big surprise to me. So, I wear a number of hats at UCSF, in part, leading work around Asian American health, as well as, being co-director of the Multi-Ethnic Health Equity Center at UCSF. Being a parent is a big important part of what I do and really grounds the work that I do. And so helping to see the world in different ways and helping to contribute to efforts to make the world a more sustainable, equitable place, especially for the next generation. So we're going to, today's seminar, we're going to follow this paper that we published in Qualitative Health Research. It came out last year. It is open access, so you can use the QR code to directly download it, and you can reference it during the talk today or have any questions afterwards. And so the talk today will really follow the organization of the manuscript. So I'll contextualize the approach within the visual methodology literature and really the rationale impetus that led us to do this work. And Anthony, who was one of the main people that helped create the step-by-step process of the approach, will then talk about the approach. And then we'll have a discussion about implications, opportunities, and limitations, and really welcome your input throughout this, because this is something we've sort of developed in our own bubble, and we're interested in seeing how other people might want to use or apply this to their work, or how they think it, could have application in the visual method literature. And so one thing as a clinician that I learned a lot about was really about visual methodology in the literature and situating it sort of already in what we know about visual methods. And so visual methodologies are approaches to help us understand and interpret images. And so the work that we've done, our group, has really been focused on photographs. And in any ways, it could be any image, something that someone drew, anything that could be captured and uploaded and saved. And one thing that I was very familiar with this, and maybe you are too, as well as photo elicitation, where there's use of photographs in a variety of different ways, either participant-generated, research-generated, co-produced, and they're used in conjunction with a qualitative method, such as ethnography, interviews, and focus groups. And so a very common approach that many of us may be familiar with is photo voice, which is one of the which was the initial methodology that led me into pursuing more work in visual methods. And so this is a elicitation approach that's participatory action research. So participants may be guided or prompted to take photos to really illustrate their beliefs and experiences that otherwise may be difficult. And then the process is two-step, not only taking the photo, but also sharing it and really using it to catalyze social or other types of change. And so here we have a couple photos of individuals. Does anyone know who they are?
I'm very curious about who they are, but I don't.
Yeah, so one is Stuart Hall and the other one is Jillian Rose. And they both are, I had to learn a lot about them, but they both are, visual and cultural studies scholars that really kind of help us understand how do we make meaning of images. And so their work talks about how, visual images are representation of our shared culture, about our concepts and ideas. And that, the meaning of images, when we see something like we go to an art exhibit, we look at the National Geographic, or we look at photos on social media, the meanings of the images, just like with any system of language, are fluid and multiple, right? There's not one truth or one way of making sense of what we see. And so analyzing photos should take into account. The intent and purpose of who was taking it, the context of power, social structure, of where the image, where it was taken, how we were examining it, maybe as researchers or different members of the community, and how, we may be looking at images may cause reflection. We're examining ourselves about, what may not be actually visible in the frame. And so there's a lot of considerations when we're looking at images about thinking about who was involved in the process, who took the photo, what did they intend to do, who was intended to see it. And so this whole process is something that, I think we're bringing to question to think about, in different health related research settings, or even in healthcare, what are the photos that we're seeing? What are we making meaning of? And what was intended to make meaning of? So these are all, I think, really interesting questions that I think our approach sort of tries to address or bring to light so we can talk a little bit more. But as we, as someone that has been doing visual methods research for the last 10 years, one thing we actually identified through literature review and also through that there was really a lack of a well-described, detailed photo coding analytical process that could be applied to research studies. So we encountered a lot of studies that did include images, photographs, and they talked about how participants or researchers coded them, but really in terms of what that actually meant. How did they look at the photographs? How did they determine the code book? What was determined to be truth or right, or what was the process? And so those are very unclear, and was something that we identified from the literature as a significant gap. So some of you might be asking, why is a clinician talking about photos? And so about 10 years ago, before I had children, my husband and I used to dine out in peace and eat at a lot of nice restaurants. And, my husband did something I think that was kind of very popular back then, take photos of, the food we would, before we could eat it. I was like very well conditioned. I had like wait till I took all the photos of our food before we eat. Now that could, never happen since we have young children. But I think, this was some of the best inspiration for, the work this line of work that we've developed about what can we make meaning of these photos? Are these photos help us understand, behaviors or habits or preferences and perspectives that can be incorporated into health-related research and even clinical care? And I think, it's also oftentimes looking at the photos, there's something, that you see, but then does it represent something else? What about the experience? And so this is something you and I all do, where we send photos to each other, post on social media. And so this is, I think, something we're trying to some of our work is trying to capture into how we could bring that into clinical interactions. So I'm going to talk about briefly the studies that sort of led to the impetus to do this work, our rationale to develop this methodology. And so the methodology was created utilizing photos from the study that I completed a while ago as a fellow that looked at older Filipino adults with cardiovascular disease. And the impetus for this work was that, cardiovascular disease is the leading cause of mortality and morbidity among Filipino Americans, yet we knew very little about how, their eating habits or preferences led to potential risk factor for cardiovascular disease. So the study, when I conducted as fellows, we sought to explore attitudes and beliefs about dietary behaviors among older Filipinos with cardiovascular disease. And we did it sort of with a multi-pronged approach. We used a survey, focus groups with photo voice, home visits, and then we engaged in the community to develop our research procedures as well as to interpret the research results that we collected. And so there was a lot of we triangulated what we learned throughout these different methodologies. And this was an older Filipino American population, age 55 to 84. We collaborated with the Bayanihan Equity Center based in the South of Market neighborhood in San Francisco, which is a neighborhood in San Francisco with a concentration of Filipino Americans. And we had a broad definition of history of CVD. And so we engaged in a standard photo voice process where we oriented them around the objectives of the study. We provided a disposable camera. This is how long ago the study was. We gave prompts for them to take photos about their food experience. They dropped off this disposable camera. We developed them. We printed 2 copies. We had a focus group, and they presented photos and shared them within in-language focus groups discussions that was led by a Tagalog, bilingual Tagalog English facilitator. And these are the little things of what we learned that I can show you some of the photos that kind of can give you some sense of why we were curious about what participants would talk about what the photo meant to them. But as an external person examining them, there were a lot of nuances or things that were, we would be curious about that we afterwards be like, oh, what does that mean? We should have explored that a little bit more. And so this was a participant that shared a photo regarding Manila Oriental Market and the importance of retaining ties to the Filipino culture. And they talked about how this market was a source of food where I shop at the Filipino market because we're all Pinoy, we're all loyal to our food. Another way they talked about retaining their ties to Filipino culture was different foods that they had adapted over time to foods that were common here in the US of traditional foods, so pinkabag, maplay, and tinola. And I think this photo, when we were looking at it, we were able to identify, and the participant did talk about the different foods that they were sharing. But I think, if we take a bird's eye view, there's a lot of different content that you also see in this photo, right? The stack of boxes, which actually turned out to be cheese that the food pantry would distribute, but they could not eat because they were lactose intolerant. Different foods, maybe religious objects, medications, situation in terms of maybe people that are partially in the photo, maybe representation of more than one person eating a meal. I think are all interesting questions that could play into learning more about the process or their experience engaging in something that it may not be it may be so typical to them it's not obvious for them to bring up, but the photo sort of makes you curious and want to ask questions about that a little bit more. And so this one also talks about adaptation of eating habits, the photo that was initially on the initial slide here. And they talked about how they eat. I also eat our food crops, but the ones they have here, we don't eat them in the Philippines, but I got acquainted with them and now I eat them. So this was another way this population adapted their eating habits. And lastly, just as a snippet, we also learned here's a different type of photo where the adaptation of their eating habits was for Western foods and beverages, right? For taste, cost, and convenience. And we also see here, there's something about where the food is situated exactly, right? What kind of things do we see in context here? The chair, the type of furniture, how the food is, being potentially served in contrast to the food where you see the picture where you see different foods, there's paper towels. So it kind of gives you a different sense of what may be the context in which this photo was taken, in which this person experiences certain food constraints or concerns. And so this was something I think we initially, maybe it was sort of touched upon in our interviews, in our focus groups, we did do home visits. But then reflection of looking back at the photos, there was always something, I felt always something more about the photos that showed that, I wish we had explored more when we were collecting the data and discussing this with participants and community members. And so this was kind of one significant impetus to contribute to developing this photo coding analytic process. The a lesser part, or actually kind of concurrently occurring, we were developing an intervention to have clinicians or patients take photos around health and social behaviors like their dietary, their food experience, their medication use, their home environment, especially for older adults if they have fall risk, to share those with their doctors and see what happened. And so this was a project that we undertook for older adults that had multimorbidity, more than one chronic condition, also food insecurity. And then they had took photos around their diet related experiences. And here we learned a lot about, in this photo was representation of a photo someone took, not only the foods that they eat, but also some hints about other behaviors that they're undertaking. Maybe you can see a little bit of a lot of objects in the background, right? Different papers, medications. So it may query a lot of different types of health behaviors, interactions that might be important to the work that we're doing or the clinical care that we're providing. And so in learning about this work, we saw the impact of how the photos empowered patients to really talk about what was important to them. It was a tool to engage their clinicians, to focus on the content, and really empowered and activated them, shifted the power differential. And so for this participant, they talked about, she was really paying attention to what was really bugging me, and get me. And like, now I feel better. Now I want to start looking for the good things because she listens to me. The listening, I think I had a lot to do with it, that you just don't talk and you don't hear no. And she had to listen to every single thing, and that was very important. And how the photo was sort of a tool for us to engage in this sort of more active listening for the clinician, for the participant to really share what was important in that. And then concurrently, the power of the photo to communicate was this. I think this participant really summed it up nicely. It's that moment when you're sharing information at a level that has no political issue involved. It's a pure 100%. Here are my findings. This is what I'm doing. Then the person that's taking that information into consideration is now cognizant of what I do. I think that's great for humanity when you're able to do that, to share. So also, thinking about participants or, patients or research participants sharing photos, there's maybe some intention of what they're trying to share, but also a lot of dialogue that can come from the photo as a communication tool to reveal, or, you can notice things that maybe they didn't even notice that wasn't right. And finally, the pictures that we saw here showed not only the background, but also able to talk about things that maybe they didn't talk about. And so plus there was actually something concrete that could complement some of the ideas or concepts that maybe one had discussed in the interview or in the clinical setting, but yet, what that might mean, representation in my mind and your mind may be very different. And the photo kind of helped facilitate it a little bit closer to understanding what maybe the participant or the patient wanted to convey. And so this participant conveyed all the positive that came from sharing photos. So now I'm going to transition to Anthony to talk about the actual two-step method to coding visual data.
All right. So after recognizing that there's potential value in the elements portrayed in visual data beyond just meals and food items, and the relevant implications that may have for health research in the clinical care space, we decided to really explore how we could systematically code photographic data and capture informative elements of both the foreground and background of photos. Next slide, please. So to start, we needed to understand exactly what the foreground and background are in photos, right? We needed to define them, and we started off simple. Two coders, myself and another team member, we compiled all the photos into a PDF, put them on our respective iPads, and we reviewed them closely and independently, thinking to ourselves how we would define the foreground and background. There was a lot of discussion on the foreground. Should it be the first third or the first 2/3 of the photo, or should it be the very center of the photo? But from this discussion, we realized two things, right? One, because there was so much discussion centered around the foreground, it's important to define that first so that we can define the background. And two, we needed to acknowledge who took the photo, right? What prompted them to take the photo and their intentions for taking the photo. And we ended up defining the foreground as the photographer's focal point that depicted their food experience, at least within the context of this study. And as you can see here on this slide, we marked the foreground with the red border, so everything inside is considered the foreground. And as for the background, well, that just kind of became everything else that's outside of the red border. Next slide, please, Jane. And here's kind of a closer look at that red border. Now that we figured out our definitions for the foreground and background, we moved on to some actual coding. Naturally, we decided to start with some open coding, just freely jotting down thoughts as we reviewed photos. And we did this with a subset of photos that we randomly chose. With each photo, we drew the border to separate the foreground and background based on how we defined them. As for the coding, we jotted down notes on the side. What you see here is a direct screenshot from my iPad when we were doing this. The red text was in reference to the foreground. The blue text was in reference to the background. And the little green text you see on the right side here was just simply random thoughts. My coding partner and I, we would meet and discuss our coding to see what we found. And whenever we met, we wanted to accomplish two things. One, we wanted to make sure that we were in consensus in terms of the foreground and background, in terms of how we defined it. And two, we reviewed our codes and to see how they fit together and discuss any potential discrepancies and thought processes while we were coding. We eventually organized the codes into different categories. However, a very noteworthy thought that we had during this stage was that we realized that there would be some utility to having two separate code books, one for the foreground and one for the background. First of all, referring back to our entire goal for this, right, was that when looking at the foreground, it kept all the elements that the photographer wanted us to see when they were answering the photo taking prompts. But the background captures all of this additional contextual information that we're trying to understand through this new process. In addition, we got to see a lot of relationships within and between codes from the code book, and I'll get into this a bit later. But Jane, can you show the next slide? So this is another example of kind of our open coding, another photo in terms of how we define the backgrounds, and also our open code in terms of what we were seeing in the foreground and background. Jane, next photo, or next slide, excuse me. And here's another example as well. So you kind of get a sense of what we were seeing as we were open coding. Next slide. So once we developed the preliminary code books, we moved to using Dedoose, which is an online qualitative analysis software that has photo coding functionality, unfortunately. All the photos that were exported and uploaded to Dedoose and the code books were inputted in. After all that was done, we started coding for all the photos using the code books. Again, we would define the foreground first, which is what you're seeing here. In Dedoose, you can click and drag a box over the photo and then apply codes from your code book to that box. And you kind of see that code book on the right side here that you just kind of double click and it applies after you draw the box. The way that we separated the code books in Dedoose was by creating two large umbrella codes denoted as foreground and background. For every code in each respective code book, we denoted which code book it came from by putting an F in brackets for the foreground and a B in brackets for the background. Next slide, please. As for the background, we arbitrarily drew a large box around the entire photo, simply so that we have that box to apply the relevant codes, which is what you're kind of seeing here, in addition to kind of the foreground box that you see as well, that's focused more on the table, and that's that focal point of the photo. And with all that said, Dedoose ended up being a really valuable tool for our particular process. And just to kind of point out, you also see I wrote down the applied codes that we had here, so you kind of see our thought process and like the type of discrepancy we might have had when we were discussing our coding. And I'll talk more about that later too. Next slide, please, Jay. And here you have kind of both coders boxes overlapping each other. And the way that we kind of were able to see which codes were applied to what is that you hover over those little brackets that's at the top of the photo and at the left of the photo, then the codes would pop up so you get a sense of who coded what were the codes that were applied by each coder. But anyways, so we continued to code all the photos, and we met in between coding a few sets of photos to continue discussing and refining both code books. New codes and code definitions were constantly emerging and changing as we went through this process, but did reach a point of saturation and no further code book development was conducted, at least on our end. Next slide, please, Jane. So a little bit of a recap of the development of our coding process, right? So we started off by trying to understand the foreground and background, especially in the context of the initial study that was conducted. After defining those aspects, we conducted open coding to start identifying different contextual information from our visual data and to inform the development of two preliminary codebooks. Again, one for the foreground and one for the background. The codebooks and photos were then brought into Dedoose so that we can utilize Dedoose's many functionalities in our analysis. In fact, Dedoose allowed us to look at those interrelationships and intra-relationships between the codebooks. And in Dedoose, you're able to look at the co-occurrence frequencies between these codes. And that's how we looked at those relationships. So this was really helpful for understanding how the foreground and background sometimes supplemented or complemented each other in terms of what was informative, but other times they also provided unique and distinct bits of information, right? But I digress. We continued coding until we were not finding any new codes emerging. Jane, next slide. So there were a few lessons that I and the other coder took away from developing this process. For instance, finding a means to come to a consensus on coding for certain photos involved a lot of discussion that really conveyed how we each interpreted the definitions of certain codes. You know, for example, and this kind of goes back to, I think, one of the photos that I had shown to Dedoose, right, was, you know, what exactly is considered quote unquote low for like a dining table, right? What was our interpretations? Why was this even important to us in the context of that prior study? And through the discussion, it required a lot of compromise and refinement of the code definitions to meet both of our interpretations. However, this speaks a lot to how this was coded by, if this was coded by another pair of individuals, the results may be different. And kind of backtracking a little bit here, you know, what might have this looked like if we brought this methodology back to the community level and involve participants in the coding process? Again, the results would likely be different and potentially even more robust. Another lesson is that context matters, right? When I say this, I'm referring to what elicited the development of these photos. We tackled a lot of conversations about this while defining the definitions of the foreground and background. The foreground did not always stay in one place across the photos, and that spoke to why the context of the study matters. And again, it refers back to those questions I was iterating earlier. You know, who is taking the photos? You know, why are they taking the photos? What are they trying to show us? What are they not trying to show us? Or what are they unintentionally showing us, right? These are important points of context that should be considered when thinking about the foreground and background. So Professor G also had tasked me to provide training to other research team members on the systematic coding method, and there were some lessons taken out of that experience as well. First of all, I realized that it was important for me to really provide that backdrop, you know, as to why this method was relevant for health research. And quite frankly, it's a way for us to systematically pinpoint information using our own interpretation of what is relevant to health. What are we informed by, right? In particular, you know, what are the social and environmental determinants of health? And second, this goes back to personal interpretation. But as I was going through examples of photos that were coded, you know, other team members were noticing other aspects of the photos that I didn't notice, simply because their interpretations are influenced by their own personal culture and positionality. You know, this particular team member has a better understanding of the study population due to their shared culture, right? And again, it speaks to how vital it is and how important it is to understand who is doing the coding and how that influenced the results that are generated from this method. And I'm going to turn this back to Jane now.
Thanks, Antony. So, you know, we can open up for discussion here. I just have a couple more slides that talk a little bit about the implications and potential opportunities and limitations. And while I think this was a paper where I would say the review process was actually really productive, you know, sometimes you get a review or two and they're just trying to like make your life, you know, you feel like they're out to get you. But really, I think many of the comments from the reviewers to this manuscript did help us situate and help us think about this more thoughtfully, and it really did make the paper better. So, and you know, as I said, we've worked on this a little bit more in our group, and we're interested what others think about it and what they think they could incorporate in their work. And I think it's sort of like, you know, phase one of this approach that we're just proposing to consider for people to use. And so, as a clinician, you know, as a health-focused researcher, I think the implications of this approach is that it can be applied to any form of visual data. Right? It could be, you know, I'm thinking about like, you know, if you have chart notes that people hand wrote, you know, I know we're mostly electronic health records, but, you know, anything that people doodled or wrote down, anything that can be captured, uploaded, preserved, could be a form of visual data, even diagrams, right? And I think this approach, the approach that we've talked about is really systematically surfacing data from a photo, just like, we systematically do that for other forms of qualitative data. It's considering visual data as a way and having a process to try to surface as much of it as you can, while acknowledging their potential limitations and acknowledging that there are a lot of different components or stakeholders at play in how we interpret this data, how you surface the data. And I think some of the considerations here is that, for those our clinicians, we're interested about telehealth encounters. What do we see in the picture of the box? Like, what do you see in my box? It's all blurred, right? This is my office / guest room. But what are the things that you see that are in view in the box that could be illuminating or maybe the participant didn't intend for you to see, or what do you see, and what does that, help? Does that bring any new conclusions? And I think, there are potential benefits to our initial work that's shown that this could reduce power differentials between clinicians and patients, right? Really helping address some of the communication gaps and having patients have agency and be empowered to share what's important to them. But I think there's also some potential risks about the more prevalence of using visual data or sharing visual data in clinical settings, right? How do we consent in this process? What gets included in their medical record? And in some cases, right, what they see, is what you see, is that truth, right? Is it for certain this person's engaging in something that's good or bad, right? And so I think thinking about how we need to guard or about perpetuating stereotypes or biases are important considerations as we think about using this in other settings and in other types of studies. But I think there's opportunities and limitations. I think there are a lot of interesting components. Anthony brought up about co-production of participants, right? We conducted the study after the study had long been completed. The participants had moved on in many phases of their life. We did engage with the executive director of the organization we partnered with for initial data collection, who provided some initial input in our manuscript, and so this is something to consider, just like you might incorporate patients and other parts of your data and analytical process, that you may incorporate participants in the photo analytic process if it's something you wish to include. And one thing one thing I've really pondered about is the image as a communication tools in popular media and, in life. It is a tool, but why don't we use that as much in clinical settings or in research? And I think there's some considerations here about how do we more consciously incorporate reflexivity, right? In our lens, the way we see the world, our positionality, our lived experiences, which impacts how we view or understand, make meaning of things. And then also balancing that with participants' intents and purposes. I think it's complicated, but I'm also really excited about it because I think it could bring new directions, help us have deeper understanding about the things that we're trying to understand and learn about. And I would also say, we undertook this well after, all our data had been collected, but I think we would have learned a lot and would have changed maybe the course of our research project had we initiated the coding of the visual data during data collection, and then maybe sought input from participants. And I'm not sure how exactly it would have worked out, but I think that's something we're thinking about now in different phases of the work that we are collecting data that include visual data, how we need to do that. So that's what we have in terms of formal slides. We're really interested in what you all think and sort of feedback and your thoughts. So here's our email addresses. You can learn more about our research lab at those links there. So thank you so much.
That was wonderful. Thank you both so much. Kim, is it okay if I actually kick it off with a question of my own that just occurred to me?
Absolutely, but I just also want to say, Jane and Antony, what a really detailed and clear presentation on the process. I really appreciate the time you took to help convey what you did. I'm really curious about the findings, but I appreciate that this was really focused on the process. So thank you for that. And go ahead, Julia.
I completely agree. So, okay, the question that occurred to me while you were talking was about how kind of, demarcating this foreground and background, it kind of provides an opportunity for grouping for comparison. And I was, like with the idea of like a research question, like is certain content more I hate to use the word prevalent, is certain content more present in the foreground of photos that have a certain kind of content in the background? You know, those kinds of research questions. So kind of overly simplistically, foreground being health behavior and then background being context. Like, is there a way to group for analysis that way?
I'm gonna let Anthony take the first step, or
Yeah, I think at least in our experience, we did see like that pattern where there were like certain codes or certain elements that we were seeing that was more common in the foreground and then more common in the background as well. And I think, you know, moving forward in terms of how we would just better group that, it just goes back to labeling, right? Because we did have a lot of umbrella codes for singular codes as well. It depended on terms of like how robust we were seeing certain bits of information. And also just we want to also recognize the limitations of of how we interpreted the photos as well, right? For example, you know, like if we're seeing a lot of narrow space, a lot of clutter, and all of that, like how far do we really define that? And then do we want to make it an overall umbrella term, or do we want to and then capture many things in it, or do we want to be more detailed and minute about it and have codes that are very specific to very tiny little things that we were seeing in the photos? So there was a lot of adjustment in terms of that. In terms of, you know, should we further categorize? Should we maybe make it separate? And it really went back to us really reflecting on just how robust the data was and also keeping in mind how we were interpreting things. But really, at the end of the day, in terms of how we were kind of organizing it, which is, again, just your basic umbrella terms, umbrella codes, and more specific codes, and then kind of looking at the co-frequencies or the co-occurrences between those umbrella codes and between the very specific codes as well in Dedoose. So yeah.
so one thing I would add is that there are many photos in this data set because we directed the participants to really illustrate their food experience that only included food, right?
Okay.
Yeah. So I think, you know, it's really situated what are your prompting maybe participants take photos of or what you're trying to evaluate. And then I think that grounds your code book and what you think might be interesting things, right? It's more of contextualizing the focal point of what you're trying to study. So for us, it was food experience. And then we learned a lot about their home environment, cultural beliefs, interactions they had with others that maybe they are very related to food experience. But I think, you know, looking back, because we did this all after the study was completed, if I had looked at the pictures sort of with the critical eye that we looked at this way, I think we would have asked some different questions, or we would have explored some different things that maybe, you know, we had surfaced a little bit or talked about it a little bit, but didn't really go too much in it because the participants didn't really talk about it that much, or maybe it's something so obvious to them but wasn't obvious to us, and then we missed that small opportunity in our dialogue to carry that direction. So, but I think the photos, you know, if this is something you're doing a study on X, you know, and then you're starting to look at it, you might generate new questions that you're like, okay, maybe the next one with the next set of participants, I'm going to ask them more about X, Y, and Z, or ask them to take photos about this, or maybe I need to change the prompt, right? So I think it's really guided. This is a very static data set, but I can imagine it's much more dynamic in real life if you're applying it to an ongoing research study.
Great. Well, thank you both so much. It was a wonderful presentation.
Questions from the audience?
We have a comment from Dr. Tetanowski. Working with persons with aphasia who use text and photos as communication to compensate for the reduced language ability. It'd be really interesting to code these for social and communication functions, as well as compare an unfamiliar coder's codes to the text recipient's codes, and then the sender's intended social and communication functions. It's an interesting idea.
Well, because I'm thinking that in this case, the photos, they are emerging from, I guess, a digital interaction. So I got a client who if he's coming late, if he's late to treatment, a lot of times I will get a text and it's just a photo of the view from his front window that shows all the cars in front of him. Or I might get a text that just shows our clinic waiting room. So it's like, yeah, I'm here. And so I think it'd be really interesting to subject those kind of photos to like what as the recipient, what do I think is his intended message, both communication as well as social, but then to go back and maybe just, if, you know, kind of form from the literature, you know, get a set of codes that we know why people communicate and what's the social function. And for him to be able to say, well, this is why I sent the picture and this is what I wanted you to know.
Oh, I think that's a really interesting insight, because I think you're pointing out a lot of applicability about training a lot of different types of people involved in healthcare, right? Researchers and clinicians about how can we use photos as another sort of language, right, for people to communicate. And I think, yeah, that's something to consider, right, for patients, especially for those that may be using photos as their main form of communication and traditional. But I also think we should guard against, as I mentioned in our study, like holding on to our own view, right, our own stereotype or bias, and really closing that loop and engaging with the person that's taking the photos to engage in dialogue, right? To understand what was their intent, what can we learn. And I think, yeah, this could be a new consideration of using photos in these healthcare encounters that really could give voice to more people about what's important to them, and then help us learn or maybe talk about things that we may not have initially intended to talk about, but maybe not triggered, but, you know, brought upon or elicited through the photos. So thank you for that comment.
Sure.
I saw Lania had her hand raised earlier.
Oh, yeah. Thank you so much. I'm a Filipino immigrant, so it was really interesting, and thank you for doing research on the cardiovascular diseases going on in the community. There's also a lot of diabetes and such, like things that don't get researched in that community. I was wondering, this is more about the results, but what were you seeing as the relationship between like immigrant households, their background, and what types of foods were being consumed in the foreground?
Anthony, do you want to?
I mean, I'll say this, that I don't think that I mean, or Jane, can you remind me if I mean, for the adults in the prior study, do we know if some of them were immigrants or not immigrants to begin with?
Yeah, Anthony looked at the photographic data without actually ever looking at any of the transcripts or any of the individualized data from the who took what photo and what was their identity and characteristics. So Anthony was really blinded to some of those things. To be honest, we probably never really went back to link, you know, what we thought we saw with characteristics or specific perspectives each participant elicited. But I think, you know, in practice, that would be something truly could be potentially, you know, help bring research in a new direction, help make a new association or connection that merit more exploring. So I wouldn't be able to say. I think, you know, the community that we engaged with was in the south of Market in San Francisco, which is a, you know, low-income, food insecure neighborhood. And so most of the participants had access to community center resources at that time because we lived in that area. And so, you know, I couldn't draw any conclusions specifically based on, you know, their living situation versus how their dietary behaviors were more connected to cultural practices or more westernized. It'd be difficult for me to say that. I'm sorry, it's a non-answer to your question, but it's an interesting question.
No worries. Thank you so much.
I think there's some question in the chat here. How long are you storing and saving the photos as raw data, not just analytic examples? So I have difficulty letting go. So this project initially we did disposable cameras. But at that time, we had the foresight to ask for CD-ROM. So all our photos are digitized already for that. And so I think, you know, for this study, now that we've concluded probably all the analytical procedures we'll take on the data set, we'll probably talk about in the coming, you know, sooner than later about what our next steps in terms of destroying the data For now, for all my subsequent studies, because they're all engaged and active, and there's still data collection undergoing, or we're analyzing it. We strictly now just have digital data collection. And we've had to, at UCSF, we have secure online portals to store our data, but we've really had to be selective and move some of it to Box because we just have large amounts of visual data. And so the thing about most of the visual data is that there's not identifiable. Many of them do not take pictures of themselves. And so for now, it's been okay in Box to be, it's, compliant in the sense that it's secure per UCSF and doesn't include any identifiable information that we have stored over there. So I think for the original data set, we probably will begin to talk about how we're going to destroy or dispose of it. But for now, we've been maintaining all the digital copies. And I know we have 2 more minutes left. I don't know if Julia and Kim, you want to help us prioritize what to answer.
I do think the question about convincing grant reviewers on the value of the technique would be helpful to have you reflect on that. And then if you would be willing to stay for a few minutes afterwards, I think we would appreciate that if possible. Otherwise, we'll put your contact info back up.
Oh yeah, I think we can probably, Anthony, we can probably stay another 5 minutes afterwards.
Yeah, I can do another 5 minutes.
Okay. Yeah, so this scope of work has taken years to fund. I was a fellow when I did my first Photo Voice project. That was in 2014. It took me, I guess this is not a recorded one, it took me 5 tries to get a K23 focused that incorporated photos on my own from NIH, right? And there was a lot of people who are like, I don't understand why you're doing this, what's going on. And I think, the last time it got funded, I submitted it right before the pandemic. And I think, for better or for worse, the pandemic really shifted about how we viewed context, right? Because we were seeing each other on all these little screens. It actually really did kind of matter what we saw in the background because maybe we couldn't go to people's homes or see them in person or see them in a clinical setting. And so I think that kind of normalized a little bit about how we use photos. I think, in popular, the way we, and so, and the way we interact with others, photos is something that we talk, we do normally, right? We share photos with our children, to grandparents, to our friends, we post stuff on social media, right? We create these photographs that we send, holiday cards that we send to our friends and family every year. So it's something that we're doing. I think what was difficult to get funded in a clinically oriented environment was that trying to show that it had some impact on how it mattered to patients, right? And so I think ultimately the people that were more early adopters or more like this could work, Jane, like this grant could work, was that they saw the potential value that patients had. And I think gathering their input and their perspective and that input, and then seeing that clinicians or healthcare providers were not anti this. They were more concerned about the burden, data burden, time burden, right? So thinking about creative ways, because some of this stuff is already happening in real life. People are, patients are already sending, doctors and nurses photos about lots of stuff. Sometimes I don't even want to look at it, right? Like different injuries, different things that came out of their body, right? Just a variety of different things. So I think, I think it will be an easier road, but I do think, explaining the theoretical basis, why this would be additive to other methodologies that you're doing and how it'd be complementary or provide a different perspective, I think is really important. And as much preliminary data or input about how other, how this has been feasible and, sustainable, and acceptable to a lot of different populations. Most of my work is in multi-ethnic and linguistically diverse populations. And I think, if anything, I hope our work can help give you a ability to be able to incorporate that to show. We've done it in older adults. We've done it in people that don't speak English. We've done it in patients or people that are, from all different races and ethnicities and different social economic status. And I think the underpinnings of some of the visual methods are really for the for vulnerable, underrepresented populations. So I hopefully that will, this will be in the future. I hope others will consider more visual methods in their work. Anthony, do you have anything to add?
Not in particular to that. I'm sure you said it all.
Okay.
Thank you. And then maybe would you mind just briefly touching on, I think, um, reviewer, Julia, did you see this question about?
I think it kind of relates to that receptivity of different audiences. I'm really intrigued about Julia Duray's, sorry for mispronouncing your name, question. I think is it okay? Go to that. So it's about how you account in this context for the photographer's awareness of the audience of the photo. And so it kind of relates to that relationship between the interviewer and interviewee, like all those kinds of dynamic relationships.
So this came up a lot in my grant reviews, or there'd be like one reviewer would be like, what's truth? What if they're only showing you like the best thing they want to show you? And I'd be like, well, that's the truth, right? I mean, when people talk to you, they're going to tell you whatever they want to tell you. They can omit or, craft whatever they want to say. So I think this is the participant's truth. This is what they want you to know. That's why it's important, not only the photo, but the dialogue, because active listening and talking about it, sometimes you might see more than it, be like, well, yeah, this is what I normally eat, but sometimes, yeah, I eat McDonald's, right? Do you know what I mean? It's so sometimes it's asking about what you don't see in a curious and non-judgmental way. So I think, I think this is my personal perspective is that this is what the participant or the patient wants to show you. And I go with that because when I talk to someone in the research setting or in the clinical setting, they may be telling me what they think I want to hear, but in the end, it's my job to engage or interact with them and try to come to a best mutual understanding of what's going on. So yeah, I think if anything, it gives more strength to the participant or patient to really say, this is what's important to me. Anthony?
If I could just add on to that question, what's your practice in terms of how much you familiarize the participant with the researchers before, like how much contact is had before they go out for photo data collection? I'm not saying good or bad, I'm just wondering.
Oh, yeah, so we've done a lot of different types of photo taking prompts where we've offered very open-ended prompts, and then they know they're in a research study, to more now we're doing more work in the clinical setting where they've actually preferred more structured prompts because they're more around specific domains that are relevant to clinical interactions, in part because clinicians wanted that feedback and patients wanted to know that the photos they were taking would be relevant to their doctors. I mean, I think doctors are really worried, oh, I'm going to get a whole bunch of photos, but patients are actually really worried, really wanted to take photos that were informative and that they would receive guidance and advice that would be helpful to them. They really wanted to provide data or, share things that were important to them. So I think, it's a spectrum of sort of the degree of guidance. I mean, we, in our most recent work about this clinical interaction, we provide examples, but they're also sort of open-ended. And then when structured, but yet not, so firm, like take a picture of what you ate for the last 3 days, right? But it's more like, these are examples of different things that you can take. And it's interesting, like what participants choose out of a list of 5 things about what they want to take. So I think that this remains to be sort of seen, potentially a really interesting aspect about how we communicate or with patients or with research participants, and then maybe asking about what we don't see or what we, as a prompt of what we might be interested in based on our research question or the clinical interaction. Mm-hmm. Well, considering this is what they wanted to show, does that mean something? And then trying to explore that a little bit more. I do have to roll off maybe in 1 minute for my next call.
Yeah, no, we want to respect your time. It's 10:06, and Antony and Jane, thank you very, very much. This was such a wonderful presentation, and thank you, audience members, for being here. Check out the publication. Thanks for putting up the QR code. I've got it on my phone now.
Great. Thank you so much. Thank you, everyone.
Thanks all. Bye.
Yeah,